Olivia Rodrigo on DubaiEye 103.8. Helen Farmer with you. Lots of you sending me a message going, Alexa, play DubaiEye 103.8. And for good reason. If you send me those words with your name, please don't forget your name. If your name is Alexa, that is very confusing. Then you could be winning your very own Amazon Echo Dot, third generation, to listen to your favourite radio station on. It is that simple. Send those words and indeed your name to 4001. You can use the ARN Play app and the WhatsApp, which is 048715500. Also the numbers to get in touch if you've got any questions for our Doctor of the Hour or you want to tell me your love story. How did you meet your partner? We're going to be talking dating in Dubai, finding love and more after 4.
This is Afternoons with Helen Farmer on DubaiEye 103.8.
With Mubadala Health Dubai, a specialty clinic and day surgery centre for every stage of your family's life. Trusted for care. Call 800-77.
Dr. Ajit Mathew with us in the studio today, consultant general paediatrician and an allergy specialist at Mubadala Health. He's there at the Sunset Mall branch for those of you who are asking. And we are talking about the alarming rise in food allergies in children. And actually, as Doctor said earlier, not just food allergies, but allergic rhinitis and so much more. And we've had a number of questions. We're going to try and help out as many people as possible in the next few minutes. We've been talking about diagnosis and blood tests and skin prick tests, but what about management of those allergies? Of course, in an ideal world, we would avoid them. But are there things that children take on a daily basis, or does it tend to be a medicine that you would take in response to allergic reactions? What do you have in your toolkit, Doctor?
So basically, the food allergies, the easiest way is to avoid that food. And by testing, we know which food is allergic to. And to avoid that, because some of the food allergies, initial reaction may be very simple, but later it can be life-threatening reactions. So there is no particular treatment for allergic reactions, allergy to, but there are some new developments where we have for some food like peanuts, we call as immunotherapy, oral immunotherapy, where it's not to make the child, okay, he can take a lot of peanuts and all, but at least by mistake, she has taken a little bit quantity of peanuts, then they will not go to that severe reaction. That is the only but it's only limited to very few foods, okay? It's not available for all the foods. Okay. So the best way is to avoid. But our main aim is to, in case the child develops a severe reaction, our main aim is to detect it early and to give the treatment. The treatment is the most important treatment is adrenaline injection. So it is available by auto injectors. So if the child is labeled with the food allergy, don't wait for that to have a severe allergies. If it is labeled as a food allergy, then always the child should carry this we call as auto injectors. Many brands are available like Juxta, EpiPen. So carry that. One should be at home, one should be in the school also. And wherever she goes, especially to the restaurants and all, she should take that also. And the parents should be aware of how to give it, and they will be they should be trained for using these auto injectors also.
As well as teachers and even friends.
Yes, teachers, school nurses, school doctors.
Doctor, I wondered if I could ask you, if you had a friend that came to you and said, my wife and I are about to have a baby, when it comes to that weaning process of introducing food to a baby's diet, what should or indeed shouldn't you do to best set up your child to, in an ideal world, avoid any kind of allergies? Yeah. What can you do to get ahead of the curve for any young parents listening?
So this was our concept before that, okay, avoid as much of allergic foods, not to include in the weaning, and delay that food after 1 year. But there are many studies recently which shows that if you introduce those foods early in their life, in 4 to 6 months, the chances of developing that allergy to that particular food is less. So this studies shows, for example, they study with the peanuts. So they introduce the peanuts in one group of children early and the other group late. The children who are given the peanuts early in their life, in the infancy, so they had less chances of developing the allergy. So this is the new concept. So it's better to start, but only thing is you give one type of food initially. Each time you try with one food, and if no allergies, you go on in building. So introducing early is a good method now.
Perfect. Right, Dr. Mathew. A question from Sophie saying, when can you start detecting allergies? She says, my 3-month-old sometimes gets very red eyes. It's not tiredness.
So clinically, especially cow's milk allergy, we can even diagnose even at 2 to 3 months clinically. We don't have a specific test. Usually we don't do the skin prick test or blood test in the first 6 months. So skin reactivity, especially because in the first 6 months the maternal immunoglobulins are there, so it may be the test may not be accurate. So usually we suggest after 6 months. But if clinically they have the symptoms of cow's milk allergy or any food allergy, try to avoid it. But it's after 6 months of age.
Bobby with 2 questions saying, is there a genetic component, and can kids just grow out of them? So genetically, can that impact your propensity to have an allergy?
There is, but the relation is not like 1-to-1. Okay, if the mother has it, no, it's not like that. There is a genetic component, especially the allergy is running in the families. So definitely if a food allergy or if a parent has an eczema, a child has more chance of food allergies. Okay?
Interesting, because I had eczema and my daughter has asthma.
Yeah, so the eczema, asthma, food allergies, allergic rhinitis, all are same family. Okay. So there is a chance that if the parents have it, then the child also will have it.
And Bobby asking, can kids just grow out of allergies?
Yes, of course, especially certain allergies like cow's milk allergy and egg allergies and all, they can outgrow after 1 year. But nut allergy is usually lifelong.
It's a
lifelong thing, yes.
Doctor, we've run out of time, but we've still got lots of questions. So if people want to send me the word doc or doctor to 4001. With your permission, Dr. Mathew, I'll share your details there in Badla so people can contact you, because I'm sure it's lots of cause for concern and wanting to make sure we're protecting our kids. Thank you so much for your time. Really, really appreciate it.
Thank you.
Joining us in studio, Dr. Ajay Mathew, Consultant General Pediatrician and Allergy Specialist at Mubadala Health. As I said, you don't need to put your name on, don't need to put a question on. Send me the word doctor if you would like his details, if you would indeed like to explore diagnosis and treatment for any childhood allergies. And that doesn't need to be food, as we said, it can be asthma and so much more. Lots coming your way on the show today. Keep your love stories coming in, and I'll be telling you how you can be winning that Alexa, and we're meeting an extraordinary student after the headlines.
Your ARN News.
Good afternoon, I'm Noni Edwards.